Hi, I'm Charlotte, Business Manager here at NorthGene, and today we're going to show you how to take a DNA sample for a prenatal paternity test. In your prenatal paternity sample collection kit, you have everything you need to facilitate the sample collection. Firstly, you'll receive instructions on how to take the samples. This includes both mum's and the potential father's sample. Secondly, you will receive a consent form for each participant. For mum, we require 2 blood samples to be taken. So you will receive 2 Streck tubes, and with that you will also receive everything you need to take them samples, including the vacuum toner and the needles required, plus plasters and an alcohol wipe for the area that you are taking the sample from. In addition, you'll also receive a buccal swab collection for each participant. So we need a buccal swab to be taken from mum and a buccal swab to be taken from the potential father as well. Finally, you will receive this patho seal bag, and this is for the collected blood samples to be returned to us in the prepaid tamper evident return sample box. Before the sample collection can take place, you must certify the identity of the person giving the DNA sample. The participant may choose to provide a photograph of themselves, which you must sign and certify to be of true likeness of the donor. Alternatively, you can take a photograph of the donor that you were taking the sample from and email it to our customer services team. You must also check any photo identification that the donor has available and either take a copy of that document or again take a photograph of it and send it to NorthGene at biofortuna.com, certifying that it is of true likeness of the person you are taking the sample from. For each participant, we need to complete a prenatal paternity test consent form. Ensure that the NorthGene case reference is added here and ask for the donor to read fully the donor declaration. Please then ask for the donor to complete the donor information, including their full name, their date of birth, the form of identification which you certified earlier. So this could be a passport or a driver's license. Then ask the donor to confirm their biological sex. If it is the mother's sample that we are taking, we need confirmation of how far into the pregnancy they are. Please request they also complete the ethnicity if known, and that they have read this donor history part of the form. If anything needs to be noted regarding this history, please ensure that it is inputted here. Finally, request for the donor to sign when it says donor signature. If it is the donor signing for themselves, ensure donor is ticked. If the child is under the age of 16 and someone with parental responsibility is providing consent, tick parental responsibility, sign where the donor signature box is, and confirm the identity of the person providing consent. Finally, as the collector, you need to complete your name, your collector contact address, which will be your company address, the date of which the sample was taken, and ensure that you have provided a signature to confirm that the samples have been taken from the above named donor. For the sample collection from the potential father, we just need 2 buccal swabs to be taken. Complete the potential father's name, their date of birth, and a case reference. Then be sure to tick relationship as father. Inside this envelope is 2 buccal swabs to take the samples. For the mother, we need 2 blood samples, Again, be sure to label with the mother's name, date of birth, relationship as mother, and a case reference. Be sure to do that for both spec tubes which samples will be collected in. Again, just like the potential father, we will need a buccal swab to also be taken from the mother. Ensure that the mum's name, date of birth, case reference, and the relationship as mother is ticked. Again, there'll be 2 buccal swabs inside this envelope to be taken from mum. So for each participant, take their labelled sample collection envelope, and in this envelope you will have 2 buccal swabs. Again, take the sample by rotating the swab for 30 seconds on the inside of one cheek. With the same swab, do the same on the inside of the other cheek, and then return to the plastic cover in here, and repeat again with the second swab provided from that person. Once both samples have been taken, pop into the envelope and seal before moving on to the second participant. Only a mother needs to provide a blood sample, so using the labelled strep tubes, take the sample using all of the components which we have provided to facilitate that collection. You are the trained phlebotomist, so I won't talk you through how to take that DNA sample, but if you have any questions, do not hesitate to reach out. Once you have taken the samples from all participants, you need to return them back to our laboratory. So take your labelled samples and your completed consent form, and you want to pop it into the return box. Then you want to take your 2 blood samples taken from mum, ensuring that both samples are labelled, and pop them in this Patho seal bag. And you want to remove the foil seal, press firmly, and place into the box. Close the box and use the security seal. Your sample is ready to be returned to our laboratory. You just pop it in the post.